Hi, this is Josh. I'm a pharmacist with pharmacisttips.com here with an overview of the medication prednisone. Uh, Now, with all my videos, this is informational purposes only, not intended to replace a qualified healthcare provider. You can read the full disclaimer here and in the video description. So what is prednisone? It's a steroid. Often people just call it a steroid, adrenal glucocorticosteroid. It's available in tablets and liquids. It has anti-inflammatory effects as well as immunosuppressant effects. Used for a laundry list of indications, including allergic states, skin disorders, endocrine disorders, certain GI or stomach colon diseases, neoplastic disease, respiratory diseases, rheumatic disorders group, and many, many more. Whenever there's inflammation involved, a lot of times they'll use a steroid. So dosage, huge variability. There's bursts, there's tapers, there's chronic daily use depending on the condition. There's one-time doses, but it all should be taken with food or milk as it can be hard on the stomach. Taper or not. So when do you need to taper prednisone and when do you not need to taper? Of course, that will be determined by your healthcare provider, but generally it's tapered when you want to prevent a flare. So you have an autoimmune disease or your arthritis has flared up, the dose is slowly decreased over time to prevent that from flaring up again. If you have other existing diseases or other health issues, sometimes if you're already kind of frail, a lot of times the prednisone needs to be tapered. And if you're treating a flare, so if you have had a condition that has flared up, you've been on steroids in the recent past, then a taper may be needed. Typically, we don't need a taper when prednisone is taken for less than 2 to 3 weeks, or if it's taken for an allergic reaction that has resolved, or if you're experiencing adverse effects or having side effects with the medicine, typically you're not going to need to taper. Again, decided by your healthcare provider. Some of the side effects we can see, it can stomach upset, so that's why we mentioned the food, high blood pressure, thinning of skin, depression, euphoria, high blood sugar, and increased risk of other infections. So we'll get into these just a little bit more. Some of the short term, so if you're on prednisone for a week or two or less, what are some of the things you need to watch for? Typically, if you're type 2 diabetic, it is going to raise your blood sugar. Well, it will raise anyone's blood sugar, but the type 2 diabetic may be testing, so they would notice that. It can continue for a few days after you stop the prednisone or the steroid. So you have to be cautious that you don't overtreat the high blood sugar. Once you get off the prednisone, then you could end up with low blood sugar. So that has to be careful how you deal with that. It can cause insomnia. Behavior and or mood changes can occur. It can increase blood pressure. It can cause fluid retention and increase in appetite. Some of the more long-term side effects are when you're on this longer than a week or two, or if you're on it for months. Osteoporosis, so you need to get checked out. Your bones could weaken if you're taking it long-term. Weight gain can occur. Worsening of diabetes, so we've already mentioned kind of that effect on blood sugar, so it can increase blood sugar obviously when you're taking it long term, and that can increase your diabetes. Increased risk of infection can make your body prone to certain types of infections. Increase the risk of cataracts. It can thin the skin, and it can slow wound healing time. So again, just kind of recap, prednisone is generally taken with food, usually taken early in the day, as that can offset some of the insomnia that can occur. If you're diabetic, you'd want to monitor the blood sugar. Long term, remember, we want to get checked for osteoporosis and other long-term side effects that can occur. We want to be sure we monitor for those. And the taper is generally only required when it's longer than 2 to 3 weeks. Appreciate you watching. Please like and subscribe this video.